The first exercise is called the figure eight exercise. It's the most important exercise of all of them and was developed by Dr. Joe Mercola. And when he went over this exercise with me, the light bulbs went off. Because what it does is it challenges all ranges of motion of your neck. And not just that, but also helps improve your balance and your proprioception. So I'm going to explain it, then I'm going to show you, and then give you some rules. I'd like you to do this exercise standing up, but at the beginning, because you may get a little dizzy, you can do it sitting down and then go to a standing position. What you're going to do is you're going to turn your head as far as you can to one side. Then you're going to put the neck into extension or look up. Then you're going to draw a figure eight with your nose. You're going to do that 5 times, 6 times. You're going to listen to your body signals. You don't want to be in pain. You don't want to get dizzy. At the beginning, when you're first starting it, maybe you do 3. Then you work up to 5. Then maybe you go to 10 in one direction. Then you're going to reverse the direction of the figure eight with your nose. You're going to start your figure eights out smaller, and then you can make them larger, making sure, again, that you're not in pain and you're listening to your body. Then you're going to turn your head to the opposite side, and you're going to repeat. Figure eights with your nose in one direction, listening to your body signals, and then figure eights with your nose in the opposite direction. Let me show you. We're going to turn your head as far as I can to one side. I'm going to extend it back, which is what challenges your balance on your heels. Now I'm sitting, but I will be doing it standing. Then I'm going to make a figure eight with my nose, making sure that I'm not in pain when I'm doing the figure eight. If you are in pain, just bring your neck back a little bit. Don't go as far back as in rotation, or don't go as far back into extension. We've tested this with thousands of patients. The consistency is what's important, and listening to your body is what is important. So you're going to turn your head, extend it, draw a figure eight. Do that 5 times or more, listening to your body. Then you're going to reverse the figure eight. You're challenging your balance on your heels. You're challenging your range of motion. You're going to do that to the opposite side. Doing this together on a consistent basis improves range of motion, prevents degeneration, and improves balance and proprioception, which keeps your mind sharp. The next exercise is called the occiput exercise. I'm going to explain it, I'm going to show you, then I'm going to give you some rules. What this exercise does is challenges the range of motion of your skull on top of your spine. What we want to do is we want to flex our head as far as we can to our chest. That locks out the rest of the cervicals from atlas all the way down to the shoulders. Then we're going to turn our head as far as we can to one side, and then putting our hand to the opposite side of our head, we're going to challenge that range of motion an extra couple of millimeters. And that extra rotation comes exclusively from the skull on top of the spine. We're going to hold it for 5, 10, 15 seconds. Then against resistance, we're going to bring our head back to midline, and then we're going to repeat on the opposite side. Let me show you. We're going to take our chin, we're going to bring it down to our chest. Then we're going to take our head and turn it as far as we can to one side. Then with our hands, we're gently going to challenge our range of motion in an extra millimeter or 2. Then we're going to hold it for 5 to 10 seconds. And then against resistance, we're going to bring our head back to midline. Bring our chin back down. Head all the way over. Challenge it an extra couple millimeters. And then bring our head back to midline. And then to the center. That is the occiput exercise. Again, it's important to challenge that extra range of motion and to do it in a pain-free way, so that you're not causing extra pain and discomfort in the cervicals or in your neck, and then also that you're not getting dizzy while you're doing the exercise. Do this with consistency, and remember that extra range of motion with this exercise is what's critical. This next exercise is called the lateral bending exercise against resistance. what you're going to do it's very straightforward. You're going to bend your head as far as you can to one side. You're going to hold it. Then you're going to try to stress that motion extra millimeter or two. Then you're going to place your hand on one side of your head, holding it constricted, and then you're going to push back against it. Then you're going to put your hand on the other side of your head, holding it constricted, and then push isometrically into tension. Then you're going to bring your head back to midline, and then you're going to repeat on the opposite side. Let me show you. And I like you to do these exercises standing, but at the beginning, while you're just starting, you can do them sitting to feel a little bit more secure. So you're going to take your head, you're going to bend it as far as you can to one side, you're going to hold it. Then you're going to try to push your motion an extra millimeter or two. Then with my hand on the opposite side of my head of the rotation, I'm going to hold it, and then I'm going to push back into resistance. Then I'm going to place my hand on the other side of my head, and I'm going to hold it, and I'm going to push into resistance. I'll let go and bring my head back to midline. Then I'm going to repeat to the opposite side, then go an extra millimeter or two. I'm going to put my hand on the opposite side of my head, push into resistance, and then put my hand on the other side of my head and push into resistance. And then bring your head back to midline. I want you to hold that resistance and use a resistance that you feel comfortable with, that is good tension, that will stress the muscles but does not cause pain. And it is really important when you let go of that resistance to hold the head for a moment in that position before you bring your head back to midline. Make sure that the ranges of motion that you're in, again, are pain-free. And if you can't extend that extra millimeter without pain, just do it within that first range of motion until you get good at this and you keep doing it consistently, because it's the consistency in doing these exercises all together which is going to transform the health of your cervical spine. The next exercise is called the 8-point isometric exercise. This is a cervical strengthening exercise, and it also stimulates in something called mechanoreception, which releases tension in your neck. What I'm going to do is I'm going to explain it, then I'm going to show you, and then give you some rules. So the exercise is basically putting your neck in 8 ranges of motion and then doing an isometric muscle constriction back against that range of motion. Let me show you. So I'm going to turn my head as far as I can to the right side. Then with my hand, I'm going to place my hand on the left side of my head, holding tight, and then going to push against a held constriction, muscle tension. I'm going to turn to the opposite side, then I'm going to hold, and I'm going to hold against restriction. Then I'm going to look up, put my head on my forehead, do the same thing. And you want to make sure that you're really stressing that muscle constriction. You're going to look down, put my hand on the opposite side of my head and pushing up. And then these 2 ranges of motion are really important. You're going to turn your head and you're going to extend up, and then you're going to push forward against restriction. Again, with my head rotated, you're going to look down, and then you're going to push up, and then you're going to do it to the opposite side. So just to reframe: 1 range, 2 range, 3 range, 4 range, turn with extension, 5 and 6, 7 and 8. You're going to do isometric constricting exercises in all 8 ranges of motion. Again, making sure that you're holding a nice firm constriction and you're moving back away from the end range of motion. Make sure that you're doing this in a pain-free range. Don't stress the cervical joints, because the more arthritis or degeneration you have, the more discomfort you may have at the beginning. So the goal is to do this within pain-free ranges. So if this is a pain-free range for you, just go to here and then push against restriction. And then as you do this consistently, that's where the magic happens. That's where the range of motion improves, and that is where you're going to really find the true health within your spine.